address surveillance and outbreak, interestingly funded and supported by the WHO. So the actual first advanced graduates were recruited on 20th October 2008. There were 13 in number. It was very interesting. 3 lab scientists, 4 veterinarians, and 6 medical officers. So it was interesting for the first time, these 3 disciplines learning together.
Every year, Dr. Patrick will say, Chinya, I don't know whether we are going to be able to take the next year, but we've taken the 2nd, we've taken the 3rd, and today we've taken the 10th cohort. And even at the start of 10th cohort, it was still the same thing. Are we sure we are going to be able to take the 10th cohort?
Yes, I'm one of the privileged few that is a graduate of the program. FELTP is a program because it's expected that it's going to last for a long time. It's not a one-off project. It's more of a program. So the robustness of its training and its quality is such that any program area, service area, HIV or non-HIV, polio, non-polio, any other form of it, you already have the basics, the rudiments that you need to excel in that area of focus. So I can say FELTP itself is an interventional program. It can help you further strengthen your existing public health system with strong focus on epidemiology and laboratory strengthening.
I was not disappointed at all because, with the mentorship, the exceptional mentorship we had in the program, the excellent faculty that took us through the courses, and the fact that it was a well-oiled machine, a very good program with international connections, with network to ensure quality control and the rest of that, I have no regrets. In fact, I consider my education in field epidemiology as the best thing that has happened to my intellectual life within the last 10 years.
I'm glad 10 years after, it's stronger, it's bigger, it's broader, it's more integrated in the ministry, in NCDC, in Ministry of Agriculture, and it's sort of advanced some of the initial objectives of having a skilled workforce for surveillance and outbreak, responding to outbreaks in an adequate and timely manner, but also providing evidence for public health decisions.
The Nigeria Field Epidemiology Field and Laboratory Training Program in Nigeria has been profound. Many people would refer to the epidemiology that they've been involved in, the response to the Ebola outbreak, the response to many outbreaks, their leadership roles in states and local governments, and in disease programs in Nigeria. But really, for me, the important thing and the critical thing is that we're building a whole genre of leaders, people that are thought to think differently, to challenge the status quo, to look for solutions, disease detectives, leadership, a leadership cadre of a new Nigeria that we are trying to create. So for me, this is a really profound group to be associated with. I come from a history of a similar training program, and now I'm an opportunity to influence one. And I think this is a family that is interconnected with several similar families across the world. And together, we're providing for the health security of not only Nigeria, but for the global community.
All the contributions of NSTOP are actually direct contribution of NFELTP to polio eradication. And I'm going to highlight just a few. So the first is, when NSTOP started in 2012, the first thing that we did was to conduct an enumeration and landscape analysis in nomadic communities, riverine communities, hard-to-reach communities, otherwise known as underserved communities. This was done because Over the years, these communities have been neglected and have not been reached with healthcare services, but most importantly, immunization services. So when we conducted the enumeration and landscape analysis, we visited 375 local governments in the northern part of Nigeria, but also with a few in the southern part of the country. And we visited over 67,000 settlements, counted over 1.6 million children, out of which over 6% had never taken any vaccination in their lives. These settlements and these children were later included in the plans for healthcare services in these local government areas.
The Ebola outbreak in 2014, within 1-2 days of reporting, 15 trainees were deployed to Lagos. At the peak of the outbreak, we had 100 residents spread across the states that had reported cases and the states that had suspected cases or contacts. So I think in that space of surveillance outbreak, we've made progress.
I think a program that is 10 years old is a time for reflection and a time for growth. So at 10, every program has to think, what have we achieved? Where are we today? And secondly, how do we want to go with courage into the future? Do we want to continue along the same path, or are there new things that we want to do? Do we want to go down a well-trodden path, or do we want to create a new path, a path that will ultimately lead this program to produce the leaders that it has to produce for the country? The big risk to the program is if it begins to rest on its oars and things we have achieved. So the challenge for FELTP and all its partners is to keep pushing. Once you stop pushing and you relax, you will start sliding down an inevitable slope. So the challenge for every successful program is to find the motivation to stay on top. And that's really my challenge to the Nigeria Field Epi Laboratory Training Program.
It is about networks working within a system, a government system, motivated healthcare workers working on very challenging environments. So my shout out would be that let us keep the network of field epidemiologists alive. Let us support each other. Let us support the efforts of disease prevention, detection, and response. I think Nigeria, the surrounding countries, and in fact the world, needs this cadre of trained field epidemiologists. We run into outbreaks when everybody is running away from them.